This episode of Community Updates is brought to you by Pinnacle Bank, the way banking should be. Restaurants are a major part of community life. When the coronavirus pandemic was declared in early March, restaurants were among the first businesses to be shut down in order to slow the spread of the virus. Park County officials have been trying to find a safe way to begin to reopen the economy, and this last week they were successful in taking the first step.
Bill Crampton, Public Health Nursing Supervisor for Park County. You are also the incident commander for the COVID-19 response from Public Health. Is that correct?
I'm the co-incident commander. We have a unified command system. Jack Tatum is my better half in this case.
All right. Absolutely. So there have been a lot of information. There's been a lot of information that's been released this week. Tell us, kind of summarize what this means for the general public as far as businesses, as far as personal freedoms.
It's hard to isolate that all in one thing. I think the first thing everybody needs to pay attention to is the fact that Public Health Order number 2 is still in place, which means in confined places, no more than 10 people. Now, what is a confined space? Well, I'm in a small room with ham radio equipment in it. If we had 10 people in here, we'd be, have our noses in each other's ears. So that's a good confined space. As you spread out, it makes it better and better. And there's been questions coming about, well, can we do outdoor yoga? Absolutely. Maintain your social distancing, enjoy that sunshine, and do your thing outdoors. There's nothing wrong with that. For visual sake, I would say that, you ought to have 9 students and the instructor. That way, the folks that, desire to make sure everybody's doing the same thing don't have anything to complain about.
But they can't do indoor yoga with less than 10 people.
Yeah, you can. You just got to make sure you have the 10-foot spacing.
So yoga studios, hairstylists, hair salons, massage therapists, those are open again, right?
Yes, and Dr. Billen makes a good point when he talks about this. One-on-one contact is less of a worry for us. If you're wearing a mask and your client is wearing a mask and you don't have a whole bunch of people waiting in the waiting room or whatever, you have less chance of a transmission than you do in a crowd with a whole bunch of people, none of them wearing masks. So that's our real focus right now, is trying to avoid that situation.
Okay, so you can have outdoor gatherings, you can have indoors, so long as the social distancing is taking place. What about churches and things like that?
Well, we're still down to, for the time being, and I think I need to preface everything I say here by saying this is only until the 15th. This started today, and it goes to the 15th. So gatherings of 10 people are still mandatory, and for whatever reason, people are saying, well, nobody's protecting themselves going into Walmart, why can't we have church services? And I don't have a good answer for that. I really don't. But,
where are those regulations coming from? Who says you can go into Walmart, but you can't go to church?
Well, it says it in the public health orders, Public Health Order number 1, and the individual businesses are outlined in Public Health Order number 3. So, we're working hard at parsing words. For example, it does allow us to ask for a variance. The process is outlined where we get requests from businesses, we evaluate it, we apply it to the whole business group, and if we like it, then we write up, our request and send it to the state health officer.
A variance was submitted by the county last week to allow restaurants to open if they have outdoor seating available, and that request was granted Friday for Park, Lincoln, and Natrona counties, with the caveat that some safety precautions remain in place.
In the case of the outdoor seating, what we were trying to get done was give the restaurants a chance. And outdoor seating isn't the perfect answer.
Crampton cautions that because no one knows how the reopening of businesses will affect the spread of the virus, they're taking extreme precautions.
We have to do this in baby steps, because the last thing we want to do, I'll tell you, I would much rather have people point the finger at me and say, nobody died in our county, so why did you do all that stuff? And all I have to do is say, you're welcome. If 10 people die in our county because we didn't do anything, I don't want people pointing their finger at me. And, the other thing is we're really dependent on everybody trying to do the right thing as best they can.
Now that the first request has been successful, Crampton says the county is moving forward with their next step.
The Wyoming Commissioners Association came up with a template for us to use, and Sam Wild, our safety officer for the incident management team and the fire safety guy for the county, or for Cody actually, noted in there that, indoor seating could be done at a restaurant with 10 feet between tables, edge to edge, and then only 6 people around the table.
Okay.
I have to preface this by saying that's what we're working on. It is not something that has been approved, but we are working on it. Matt Hall was in the meeting with the commissioners this morning when we spoke about this. Everybody has a different viewpoint, and we're just trying to meet as many as we can. So that is what we're working on now. The way the department or the Attorney General's office has been working, that may not come out until the new health orders come out on the 15th. We don't know. But
What are you expecting on the 15th?
Your guess is as good as mine, mostly because it depends on what happens over the next couple of weeks. Fremont County had a spike in cases, and so that makes us all rear back and go, ooh. And as we go forward, we also have to develop our concept of what pulling back means. Does it mean we have 10 cases in the county and 2 people in the hospital, and we need to say, oh, we can't do this anymore? We have to go back to previous standards, or, we don't have that number yet. So a lot of this depends on metrics. And the scary part is we've had one case that we know about. The problem is we know there's been other cases in the county. They've just managed to be able to stay home and recover.
And the testing hasn't been done for those.
Correct.
Yes.
I mean,
okay.
We know that physicians have told clients that, well, it sounds like you've got it, but you've got a handle on it. I'm not going to test you for it because of XYZ, and they send them home.
Okay.
So, and that happens a lot with our flu diagnoses too. So, our fortunate thing is we haven't had anybody in the hospital. So,
Absolutely.
that's our big thing.
Okay. What about just a question about hospital services and medical services and things like that? Has that changed? Are we going to be able to go and have regular doctor's appointments now?
That's going to depend on the physician's offices themselves. We've been talking to various facilities, and we've thrown out the idea of take a number thing. Take a number, wait like you would anywhere else using social distancing. And when your number gets called, you can come in. The individual offices are going to determine how that looks for them, but I can guarantee you they will all be doing screening. So, you'll be asked questions, your temperature may be taken, things like that. How do you feel today? And it's really incumbent upon the individual to be honest about that. The side note is you go to the doctor's office because you don't feel well. However, on elective surgeries, they've already started back. And the goal right now is those simple ones, a skin cancer that you want to get removed, a eye procedure that can be done and you're out and gone home in an hour. Anything that doesn't take up major resources and expose a lot of people. And everybody gets screened for that, including the employees that come to work every morning.
Absolutely.
So, we're all trying to take care of each other. We're doing this for the benefit of the community as a whole, not just because we're public health and we say this needs to be done.
Crampton clarifies that the orders that were modified as of May 1st were Public Orders 1 and 3 set by the state health officer and enforced by state statute. But he says more modifications are expected on May 15th.
As of May 1st, both 3 and 1 were modified, 3 being the one that talks about personalized services, the tattooing, the ear piercing, the haircuts, barbers, the all those kinds of individual one-on-one services.
Okay.
Those are now allowed with specific outlines of what are expected to be seen.
Right.
Masks on both and gloves by the provider, things like that.
Okay.
Doing everything you can to protect.
Number 1 then, public health order
Had to
number
do
1?
with schools and other facilities like that. And, they said May 18th. However, Park County has elected to not have any return to school. They've come up with some alternatives to graduation and things like that.
Crampton asks the residents of Park County to please be patient as they navigate this unprecedented situation that affects everyone.
Commissioner Teal it reminds us continuously that you got to keep in mind the people's pain. And it's been a topic of conversation every time we've met for anything. How do we make this different for them and preserve the community's health as a whole? And we're constantly working to that goal, but it's just going to take a little bit of time. And I just beg people, please be patient. We're working for you. We're trying to get things eased up in Park County. Your county commissioners are working on it. Your city mayor and city councils are working on it. But it doesn't come easy and it takes time. And we have to have a backup plan. We have to have an idea of, we've hit this benchmark. We need to evaluate. Do we need to pull back? Do we need to restrict some of those, activities that we've started relaxing? So.
Okay, and then just one final question. When we're talking from a larger perspective, from the statewide perspective, is what Park County is doing, is that pretty similar to what the other counties, the conversations that are happening in other counties around the state right now?
My counterparts across the state have already asked for a copy of our variants that we've put in, and we're all having conversations because not all of the counties, but many of the counties are set up like us with a unified command system where their Homeland Security person and their public health nurse manager are overseeing operations for the whole thing. So the short answer to your question is yes. There are others that are considering this. They're feeling the pressure from their elected officials, and we're all trying to see how this goes forward. And, finally, I did some research, and we used the 1918 pandemic as kind of a guide. Okay. And everybody goes, well, everything's so different now. It is and it isn't. The reason it isn't is because we're even more mobile than during World War I. We drive into town, we spend time in crowds, we do so many different things than used to happen because we have more people. But the interesting thing, everybody talks about the second wave, and some of the state faces have talked about we will see a second wave this fall. And I got to thinking about it, so I asked myself, why would we see a second wave? Well, what happened, and they're basing those decisions on the 1918 pandemic. What happened then was over the summertime period, they didn't want to impose further quarantine restrictions because of the war effort. Everybody needed to be at work. Everybody needed to, be producing for the war effort, and they felt if they started shutting that down and shutting businesses down, then they may not have more disease, but you know, the public, the war effort would be damaged. So here we are, fast forward 100 and some years, and we look at that and we go, well, we got 3 times or 10 times the world population. Our economy is much more fragile than it was because we worked differently back then than we do now. And that second wave could really hammer us, especially if in the quiet time over the summer months, the virus mutates.
Which of course is a danger that nobody knows about. It's all complete speculation.
Exactly.
Yep.
So those are the kinds of things we're thinking about. You know, we don't want to ease into this too fast, but we don't want to go, you know, overboard to the point where we have this huge, nasty, monstrous second wave. I think we've got an advantage living where we live. We'll see.
All right. Bill, thank you so much for this information today and for getting this information out to the public. It's vitally important and answers a lot of questions.
All right. Thank you, Wendy.
Thanks for tuning in to another Community Update. Pinnacle Bank has a long history of being an unwavering partner to the Cody community, and during this time, it's no different. They're here for businesses, families, and neighbors. If you have banking needs or questions, contact them at 527-7186. Pinnacle Bank, the way banking should be. If your business would be interested in sponsoring these conversations with local community leaders, please contact me at 307-899-2799 or email me wendy@wanderwyoming.com.